Hello friends, welcome back to Complete Medical Coding. Today let's discuss few guidelines from the integumentary section. Okay, this section is very important in the examination as well as when you move forward in your career. The most important section, the most important, even in the interview questions, you will get mostly questions from the integumentary section. The guidelines, the main guidelines from the integumentary section. Hence, this part is very important. Okay, so let's learn the guidelines. Let's look into the guidelines from this section. So before beginning, friends, if you are new to the channel, please support by subscribing. And if you have already subscribed, thank you so much for your support. So let's look into the guidelines. First, let's go with the debridement. Debridement or decontamination. This is another word for debridement. Okay, decontamination. And when is debridement considered to be, when is the debridement considered as a separate procedure? Debridement is considered as a separate procedure only when gross contamination requires prolonged cleansing. Okay, if there is a prolonged cleansing in the wound, at that time we can code debridement as a separate procedure. If it's a simple repair or simple debridement, we will not code it separately. Okay, so this is the coding tip. It is mentioned in the CPT code book as well. Use of depth. While we do debridement, while we do coding for the debridement, you have to always look for the wound, the depth of the wound, how the depth of the wound is calculated. Okay, so use of depth and surface area for reporting debridement of wounds. So how we need to calculate the depth of the wound. So wound debridements are always reported by depth of the tissue removed. Okay, depth of the tissue removed. When performing debridement of a single wound, report the depth using the deepest level of tissue removed. In multiple wounds, sum the surface area of those wounds that are at the same depth but do not combine sums from different depths. So it means if it's a single wound, okay, report the deepest level of the tissue. Whichever the tissue is removed, that deepest level of tissue you have to mark, you have to report. Okay, and in multiple wounds, if there is this is in case of single wound. If there are multiple wounds in like different places or in the same area, you have to sum, you have to total the surface area of all the wounds present in the same depth. If it's in the same depth, you have to sum all the surface area. But if it is in different depths, in different sides, you should not combine. You have to code it separately. Okay. So, and here the wound should be measured in centimeter. Also, you have to look for the shape, whether it's a curved, angular, or stellate. Depends on the documentation. Okay. So, in multiple wounds, you have to add from all the anatomical sites that are grouped together. In the same depth. Not all the anatomical sites, in the same depth. You have to sum total. And if it is in different depths, you should not combine. You should not add. Instead, you have to code it separately. Okay. Now moving on to excision. Excision. This is just this figure represents this for an illustration purpose. So these are the guidelines for excision. Excision is very, very important while doing the examination, as well as you will definitely get interview questions from excision part. Okay. So excision. What are the guidelines for excision? Code only excision in case of both excision and simple repair. This is an important point. If there is both excision as well as simple repair, you should not code simple repair. You should code only the excision. Okay. Those few people might know, the freshers, those who are started preparing for examination, for those people, they will not be knowing all these guidelines. Okay. Those who are experienced will be knowing. So I'm just focusing on those who are I'm just focusing mainly on those who are preparing for the examination. So code only excision in case of both excision and simple repair. But if there is any other repair, like repairs are of 3 types, as I had already taken the class for integumentary in the beginning of this of the channel. Okay, you can compare that video also. So repair are of 3 types: simple, intermediate, and complex repair. So in case of simple repair along with excision won't code separately. You have to code only the excision. But if in the question, if in the documentation, if it is intermediate, either intermediate or complex repair, then you have to code excision as well as the repair separately. Okay, in case of intermediate and complex repair. And if there is any adjacent tissue transfer, the short form of adjacent tissue transfer is AATT. Excision is always included in the adjacent tissue transfer. So for that case, you have to code only adjacent tissue transfer. Don't code excision. If there is any procedure, if there is any question related to adjacent tissue transfer as well as excision, don't code excision. You have to code only the adjacent tissue transfer. Okay. And coming on to the lesions, excision rule always applies to both benign and malignant lesions. This excision rule always applies to whether the lesion is benign or malignant. Okay, it's the same for all. Now, moving on to coding removal of a lesion. How will you code the removal of a lesion? Here, you have to always check whether the excision is a full thickness. Excision is a full thickness removal of a lesion. Full thickness means through the dermis. The lesion which is through the dermis. So you have to always check whether the excision is full thickness removal of a lesion. Then lesion, how the lesion procedure can be done. The lesion removal can be done by shaving. There are different methods. Okay, shaving, destruction, paring, or cutting. Another name for paring is cutting, paring or cutting. So lesion removal can be done by shaving, destruction, and paring or cutting. Okay. When coding lesion, the size is determined by the greatest clinical diameter of the lesion plus the narrowest margins that are required. So this is how you have to code for a lesion. When you are coding a lesion removal, you have to always check the size. Okay, the size which is should be determined by the clinical diameter of the lesion. How much is the diameter of the lesion? Accordingly, that size you have to mark, plus along with that the narrowest margins, which is the narrowest margin that are required, the depth. The narrowest depth that are required. So all this you have to determine, the size as well as the margin. You have to see in the picture, you can see what is margin represents, the narrowest margin. Okay, and what is the size. So along with that, all this you have to consider while coding a lesion. We will do examples. Okay. Now, code more complicated as primary and less complicated as secondary with modifier 59. You have to always code for the complicated one as the primary. And then the less complicated one, this is not, I'm not talking about diagnosis, I'm talking about the CPT. Okay, so you have to code the more complicated as a primary CPT code. And then the less complicated you have to code as secondary by appending modifier 59, which is a distinct procedural service. Okay, so that's how you need to code for the lesion removal. So also while during the repair, okay, as I already told you, there are 3 repairs: simple, intermediate, and complex. When you go for coding for the repair part, you have to check for whether, like for example, if the wound is single, you can simply code, right? And if it is multiple wounds, you have to add all the wounds from all anatomical sites that are grouped together into the same code descriptor. Which means if it is, for example, if it is a simple repair, if the question is related to simple repair, you can add all those wounds from different, even though the anatomical site is different, you can add it and code it. Okay, but you should not add different groupings. For example, in the question, if there is a simple repair, if there is a complex repair, if there is an intermediate repair, you should not add all those anatomical site together. You can add only for those specific groups. For example, intermediate repair, you have to code only the anatomical sites from the wounds from the different anatomical sites which belongs to the intermediate repair. If it is complex, you have to add only those related to complex repair. You should not add simple plus complex plus intermediate. No, that is wrong. You should not add all together. Sometimes you might get a question like this, which includes all three repair: simple, complex, simple, intermediate, and complex. So you should not add all together. You should code it separately. Okay, code only the simple, like add all the simple repair together. Anyway, if it is simple, complex, and intermediate, you will not code simple. You will go for intermediate and complex only. So if it is for example, in the documentation, if it is intermediate and complex, always add the wounds from the intermediate wound repair together, and then as a separate code, okay, as one code, and then the complex repair wound as a separate code. You have to code like that, and code more complicated as primary and less complicated as secondary with modifier 59. So if in question, if there are three type of wounds, simple, intermediate, and complex, you should always skip the simple one. You should go for only complex, intermediate, and complex repair. More complicated one, you have to code as the primary, and then less complicated one, code it with modifier 59. Okay. Now, coding removal of skin tags. How will you code the removal of skin tags? For the removal of skin tags, depends on the number of skin tags removed. Initially, code for the first 15 skin tags removed. Always you have to code for the first 15 skin tags. If it is less than 15 skin tags, you won't code. It will be included in the consultation, office visit, okay? But if there is 15 skin tags, 15 or plus, then you can start coding for the skin tags. So if initially you have to code for the first 15 skin tags removed, that is 11200. That is the code for the first 15 skin tags. You can see in the picture as well, removal of skin tags. 11200 represents skin tags for the first, removal of skin tags for the first 15 skin tags, okay? And then for each additional 10 skin tags removed, you have to code as the add-on code, the secondary code. Code each additional 10 skin tags like that. That is 11201. That's the code. So we can say an example. In order to code 35, how will you code 35 skin tags removed? So 35 means for the first 15 skin tags, you have to use 11200. How much is remaining? 25 is remaining. But how we will code the remaining part? 10 skin tags, right? 10 each, 10 additional. So from 25, 10. Then again 5 is remaining. That 5 we will not code. So for that each additional 10, you have to code 11201 2 times. So how will you code 35 skin tags? 11200 as the which represents the first 15, and then 11201 again 11201 for the additional 10 each. Okay, then the remaining balance 5 we won't code. Now if it is only 16 skin tags removed, then we will use only 11200, because here only 15. We will use as the primary code 11200, and the remaining one we can't code. So 11200 only we will code for the first 16 skin tags removed. Alright. Now let's look into few important examples, and I'll be coming back with more examples in the practice questions and in the mock questions, which I had already done before. Still, I'll be coming back with more mock questions. These are just few examples for you to understand. Okay. What is the code for excision of a 0.3 centimeter benign lesion on each ear? So you have to always check for the size. According to the size, you have to mark the CPT. So here, according to the size 0.3 centimeter, you have to code 11400. Okay, 11400 as the first CPT code. You can open the CPT code book and go to the description. 400, excision of benign lesion, okay, with a total diameter of 0.5 centimeter or less. Should be either 0.5 centimeter or less. Means up to 0.5 centimeter you have to quote 11400. Sorry, 11440, not 400. 11440. So 11440 is 11440, excision of benign lesion including margin from face, ears, eyelids and nose. Yes, this is face, ears, eyelids, nose. Ear, right? So you have to quote for the ear. Yeah, each ear. Here in the question it is represent each ear. But in the description nothing is mentioned that it is for primary, I mean bilateral. So if it is for each ear, you have to append with modifier 50 to represent that it is a bilateral procedure. Either you can quote like that or you can put the modifiers as LT and RT, left and right. Okay. Now, what is the CPT code for complex repair of trunk 12 centimeter? Complex repair of trunk. It will be 13101. What is 13101? Complex repair of trunk 12 centimeter. Here the size is, you have to check for the size always. So size is 12 centimeter. So up to, see what is the description for this code 13101. Repairing complex wound of trunk of the body measuring 2.6 and 7.5 centimeter in size. The size is between 2.6 and 7.5 centimeter. It means up to 7.5 centimeter you have to mark the code 13101, and for the additional size you have to mark each additional 5 centimeter you have to mark 13102. So 7.5 plus 5, 12.5. Okay, so each additional 5 centimeter or less means for each additional means up to 5 centimeter you can add this code as an add-on code 13102 as an add-on code. So here for coding 12 centimeter you have to don't use only 13102, that is wrong, that is only represent the additional part. You have to code both 13101 as a primary which represents the size till 7.5 centimeter, and then the remaining up to 5 centimeter you can code 13102. Okay. Now next one, the patient has an ingrowing toenail. The physician performed excision. What is the correct CPT code? So here excision of ingrowing toenail, ingrowing nail removal. Excision of ingrowing nail removal. This is the code 11750. Okay. The description: excision of nail and nail matrix, partial or complete. For example, ingrown. It's already mentioned as ingrown. Okay, or deformed nail for the permanent removal. So 11750. You will get some other codes like 11730, all those, but you can use 11730 code only if the nail plate is removed. Only the one nail plate is removed. If only one nail plate, only the nail plate is removed, then you have to go for 11730. But if it is the full ingrowing toenail is removed, then you have to code for 11750. Okay. So friends, these are few important guidelines from the integumentary session. We will discuss more practice questions from this session. Okay, hope you like the video. Please share it among your friends. Please share it especially to those who are preparing for the examination. Okay, and you will get interview questions from this part. Definitely you will get interview questions from this part. Okay, so thank you so much friends for watching, and please support me by subscribing to the channel if you are new, and thank you so much for all your support. So stay tuned for more videos. I'll be coming back with more questions in the upcoming session. So thank you so much and take care. Bye.